My name is Sasha Kelchev-Korn. I'm Executive Director of Realm of Caring Foundation, and I'll be moderating your questions at the end of Dr. Bonni Goldstein's presentation. So please make sure to use that Q&A box. And then Catherine Golden, hopefully for one who's here with me, we can answer your questions throughout. So if you have questions throughout that we can get to, we'll make sure to be responding as we go. So this session, as in all of our sessions, are designed to help you get started with cannabinoid therapy, but also to consider what that looks like for you and what questions you should be asking your physician, or what would be best for you to talk about if you were to call into the care team at Realm of Caring or the nurses at Leaf 411 for support. So I'm going to hand it over to Catherine Golden to offer some insight to what Leaf 411 offers and to give a little introduction.
Hi, thank you, Sasha and Bonnie. Leaf 411 is a proud supporter of Dr. Bonni Goldstein's free educational series. Leaf 411 is a national nonprofit public service helpline and guidance call center that delivers evidence-based cannabis education through nurse-led support. Our nurses bridge the gap by speaking both languages, traditional healthcare and expert cannabis, so you can have real informed conversations about what's right for you. So I'm the executive director for Leaf 411, and we would be happy to hear from you.
Awesome. Thank you, Catherine. Yes, so make sure that you jot their information down so you can keep in touch. And for those unfamiliar, Realm of Caring has a free education support hotline that anyone anywhere in the world can call into and help you get into compensated observational research programs as well that will help us further the body of knowledge that exists to drive policy forward. So now we are going to get into Bonnie's presentation. And for those that just joined, do make sure that you use that Q&A box to ask your questions, and we will get to a short Q&A session at the end of the presentation. So go ahead, Bonnie, and thank you so much for being here.
Thank you. Let me just make sure my slides look good here. Oops. I need to stretch that out. All right. Can you see my slides okay?
Look great.
Okay, great. Thank you. And welcome, everyone. Thank you for joining us today. So we're going to talk about anxiety. It's one of the top reasons that people use medical cannabis and CBD. So we're going to look at what the science says. Why would we even think about using cannabis for anxiety? Because a lot of people think that it causes anxiety, which it can. And some practical strategies that people are using in real life, and some advice that I give my patients. Please don't be overwhelmed by the conflicting information online. I too have delved into AI and asked it questions. It really hedges a lot about cannabis, and I think because it doesn't have the human clinical experience, which is extremely important to success. And so my goal today is to simplify the science, help you feel more informed, empower you to think about cannabis if anxiety is something that you or loved ones around you are interested in getting some natural treatment. And I, of course, am thrilled to collaborate with Realm of Caring and Leaf 411. Okay, so if you don't know me, I trained a long time ago as a pediatrician, and I've worked at Children's LA. I was chief resident there. I worked in critical care transport and pediatric emergency medicine because I was a bit of an adrenaline junkie for a while. And then about 18 years ago, a friend of mine was fighting cancer, asked me about cannabis. I delved into the research, and I have not looked back. I have a practice called Cannabis Centers, and I started Goldstein Wellness with with a partner. Goldstein Wellness helps provide all this education. If you are a healthcare provider that is licensed in the United States, you can sign up for free education and also for mentorship. And also, we do offer medical discounts on hemp cannabis, non-intoxicating hemp cannabis. All right, so let's get started. What we're going to cover today is, why do we even have anxiety? What is the role of the endocannabinoid system? What does the current research show? We'll go through one of my patient cases that was very successful, and also practical tips for success. And so obviously anxiety is incredibly common. It affects millions and millions of people around the world. It often overlaps with depression. And what does anxiety look like? So for some of us, it is a panic attack. For some people, sleep disruption, racing thoughts, physical tension. Some people even get nauseous with anxiety, irritability, difficult functioning day to day, especially if you have chronic stress. And there is some understanding that when we have our stress response, for some people, they cannot get back down to baseline. And so this um, overpowering ongoing stress response creates what we call chronic anxiety or chronic stress. And that's where the systems that are involved in regulation become very important, because that tells us where we can find medicines to target those brain systems that help promote anxiety. Can we reach in and put the brakes on that? And that's really what we're talking about today, especially with the endocannabinoid system. So first, I'm just going to share with you what is the anxiety and stress response that we have like as built in. And remember, we as humans and like all creatures, we need to have an anxiety and stress response so that we can respond to threats in our environment. But also sometimes it comes from within. So the brain detects a threat, it activates a stress response. We have a fight or flight system. We release adrenaline and some other neurotransmitters. These lead to an increased heart rate, increased alertness, but we also have a hormonal response where we release cortisol, which is to help our body cope with this threat. And the reason I mentioned the key brain regions, not important to remember, but we have different parts of the brain that are working together to have this fight or flight, but also then to pull back and put the brakes on it so that we can recover from the stress response. And those areas are called the amygdala, where we detect the threat, the prefrontal cortex, where we regulate, and then the hippocampus that has memory and context around that threat or that stress response. And very importantly, and the reason I show you these three areas is because they are dense with the endocannabinoid system components. And so let's just talk about the endocannabinoid system. And for those of you who've listened to other webinars that I've done, you may have heard this before, so sorry for the review, but I think it's important to talk about, because when you understand just this little bit about the endocannabinoid system, we understand then why these plant compounds are so important to us and why they do act as medicine when used that way. So this chart here just shows you two cells that are talking to each other. They're brain cells or neurons. The cell on top is what we call the presynaptic, and the bottom one is called postsynaptic, and the area between is called the synapse. So the presynaptic is sending messages to the postsynaptic across that synapse, and these little pink dots that are represented by this number 1 here, they are your neurotransmitters, adrenaline, serotonin, dopamine, and so on. They get released in response to something in our environment or an internal message. They cross the synapse, they bind to a receptor, which acts like a lock, and it's like a key in a lock. When there is too much message, so the best example that I really like to give is when someone gets chemotherapy that causes nausea or vomiting. What happens is the body detects a threat of really kind of the way you would react to a poison. Even an IV medicine can make your gastrointestinal system want to expel, even though the medicine's not in there. It creates nausea and vomiting. And that message is being sent by those neurotransmitters across that synapse. The receiving cell can get annoyed by too much. It's over messaging. And what happens is it kicks up the synthesis of our inner cannabis-like compounds called endocannabinoids, which are made by put together, the ingredients are healthy fat. And then those travel backwards to a receptor, again, another lock, but it's called the cannabinoid receptor in the brain, the CB1. And when the endocannabinoid compound binds to the CB1, what you see here is inhibition of neurotransmitter release. It's the brakes. It quiets the system, stops sending so much message. And if you've ever seen somebody who has chemotherapy, if they take a puff of just off a joint or a vaporizer, it's almost like magic, like immediately they feel better. And it's not magic. What it's doing is it's targeting these receptors and it's telling the brain to dial down that message. And it's very similar for anxiety as well. And so the takeaway here also to remember is this system is responsible and part of numerous systems in our body to help keep us in homeostasis, help us stay in balance because we get tipped by illness in one direction or another, and this kicks in to get us back into balance. It's really just a control of the cellular messaging. That's all it is. One of the very important parts of this to understand is that the compounds from the plant do work differently within the endocannabinoid system, and that's why THC has an impairing effect. For some people, it is not impairing. There are medical low doses, microdoses often. CBD doesn't cause you to feel that impairment unless there's a significant amount of THC in there, but CBD itself binds to these receptors a little bit differently. And it's important to differentiate, and that's why some people do better with THC, some people do better with CBD. All of us have a different endocannabinoid system, and it's in the background keeping us in balance, but your lifestyle, your genetics, all of that can affect how your endocannabinoid system functions. Now, this is a chart that I've shown before. This shows you the phytocannabinoids from the plant, and you can see here raw cannabinoids. So this is in the raw plant. So the plant's sitting in a field, or you've just cut the plant. This is what you'll find in the plant. And remember, the A at the end stands for acid. It's just the way the structure is. So CBGA is cannabidiolic acid. It's like the parent. And then depending on the genetics in the plant, it will convert to various other raw phytocannabinoids, THCA, CBDA, CBCA. And then what happens is people heat up cannabis, and when we heat up the raw cannabinoids, it cleaves off the acid, the carbon, and two oxygens, and you end up getting these other compounds that are very well known to us, delta-9 THC, CBD, and then some other C and CBG. The ones in the boxes are the ones that have some evidence in studies for anti-anxiety properties. Now, some of them are just in animals. Some of them, like THC and CBD, have been looked at in many human studies. All right. So this is one of them. It's a little bit old now. It's from 2017, but it is a very kind of comprehensive review. They looked at 31 different studies looking at medical cannabis and mental health. And you have to remember, just big picture, Schedule 1 has prevented us from really diving in and doing a huge amount of research. And so some of the research that we have is what we call low quality. It's just surveys. And remember, in the medical world, scientific world, what somebody says their response is without an objective ability to measure it is usually considered anecdotal. I have talked to enough patients to know that cannabinoids really do help. But again, in the medical community, scientific community, what we want is high quality studies, which are usually randomized controlled trials. And remember that a botanical formulation like cannabis, which contains hundreds and hundreds of compounds, may not fit that randomized controlled trial model. But within this report, they did look at anxiety and depression and some others. I'm going to focus on the on anxiety and depression here. So what they found, and by the way, it was 31 different studies, more than 23,000 pooled participants. So it's a pretty good review. And overall, medical cannabis studies showed improvement in anxiety symptoms. CBD was found to decrease social anxiety symptoms. And the results with THC, when you look at all of the studies together, were a little bit variable. It depended on whether the people had medical purpose or medical intention versus non-medical use. For depression, there was improved mood and quality of life overall, more commonly in people who had the intent to use it medically. There were mixed outcomes, meaning some showed antidepressant, some actually showed increased depression, with frequent what we would call non-medical use. And that, of course, is related to THC. And remember, before 2017, we did not have a lot of studies on CBD, just a few. Important limitations, they're not clinical trials, they're low quality, as I mentioned, but the takeaway is there is evidence of benefits, and especially when it was customized to a patient's response, meaning they were feeling okay, they didn't necessarily go overboard with their dosing. Let's see. Okay, next study is, so now after 2017, I pulled out a handful of studies here to show you. I would have hoped that there would have been more. I think we're probably going to see more studies, but what I've chosen here is just to show you some of the studies that I think are higher quality. So this was a study published in 2021. It recruited 101 patients with anxiety and depression who were taking SSRIs, which are antidepressants, anti-anxieties, and benzodiazepines, drugs like Valium, Ativan, um, uh, um, lorazepam, those drugs. And what's interesting is 88% reported symptomatic benefits using THC dominant and one-to-one. Now, that doesn't mean that CBD dominant didn't work. It's just they didn't look at that. And what's interesting here is 75% of the patients used tinctures. And you can see here that many patients were able to either reduce or discontinue benzodiazepines, SSRIs, or SNRIs. In my experience, there are people who tolerate these drugs very well. Of course, I see a skewed population in my practice where people want to get off of these drugs often because they don't like the side effects, or they have tried cannabis and they just want to be able to incorporate cannabis and either lower the dose or add it for the daily anxiety. I've had patients who have come in with an SSRI and said, this is keeping me from like jumping off the bridge, but I still have day-to-day anxiety that feels out of control. And you can take these medications together. If you do, I highly advise that you talk to somebody just to make sure that someone is looking at dosing in order to avoid any drug interactions. There is some evidence that cannabinoids, including CBD, may elevate the SSRI or SNRI levels in your bloodstream. Certainly not out of whack where you would become toxic, but again, it's always good to talk to somebody ahead of time. Side effects. In this report, the most common was somnolence, which is just kind of feeling a little bit tired or drowsy, and that certainly would be related to the THC component. This is a study that looked at CBD for treatment-resistant anxiety in young people. So this is unusual in that it recruited people under the age of 18. Ages 12 to 25 were included. It was a small study, only 31 patients. But the criteria was an anxiety disorder and no clinical improvement with cognitive behavioral therapy and or an SSRI. And in the literature, they will call this a treatment-resistant type anxiety, that you're not responding to the typical or what standard of care therapy. So 12 weeks of CBD treatment led to significant improvement in anxiety. They also had improvement in mood, overall symptom severity, and daily function. Now, there was a high level of side effects. So why? Well, I didn't put it on the slide. They increased the dose in these patients up to 800 milligrams a day of CBD. When you look at the scientific literature for CBD and anxiety, often the doses are high, 300, 400, 600, 800 milligrams, which actually may not be doable for the vast majority of people because of the cost, but also because of the side effects. So what kind of side effects do you see with those high doses? You can see sedation, somnolence, gastrointestinal upset, nausea. I've had patients complain of nausea at high doses, and also diarrhea can be a problem. And so in this study, often, it's hard to take this and then apply it to what I do. But what I would share with you is that in the studies, it shows benefits. And then the question becomes can we take advantage of what we call the entourage effect? So CBD with some THC in there, CBD and CBG together, which I'm going to get to. So there are ways clinically. Remember, clinical practice is very different than what people do in a study, because in a study you have to follow the protocol. But in clinical practice, we can get sometimes better results with lower doses, especially if we're using a full spectrum and or engaging with a multitude of cannabinoids. So, but good results. I mean, there was statistically significant improvement. And again, this is in younger people, which you don't usually see in cannabinoid-based research. Now, this is also a pretty good study. So this comes from if you look at some of the people in the list there, Heather Jackson, who was one of the original founders, I believe, of Realm of Caring, and also our friend at Johns Hopkins, Ryan Vandry, who's a excellent cannabis researcher. So this is, they looked at 368 cannabis users in 170 controls who were considering cannabis but had not started using it yet. Okay, so just be aware they were people who were kind of curious, I might say. Participants who initiated or continued medical cannabis during the study had statistically significant reduced anxiety and depression. Okay, so the people using medical cannabis during this observational trial had good results. And what's interesting is they followed the participants who never initiated use, and they did not see any improvements. And that might seem kind of like odd, but sometimes, you know, you want to separate out, is it situational, or do some people get better over time? I mean, I know for me, certain things in my life trigger way more anxiety than other things. So sometimes life happens and your anxiety goes down or your anxiety goes up. So, but this was a very interesting approach. CBD dominant products were used most often. And in terms of safety findings, 61% saw no perceived harms. Side effect, and if you look at the list of harms, some of it was cost, some of it was legal, so it wasn't necessarily physical symptoms. Side effects were mild. THC users had more adverse effects than non-THC users. This is very common, and you have to remember that while you are trialing THC, you are looking for the dose. Other studies show that most patients who are trialing cannabinoids will have their side effects within the first 1 to 3 months of use, and that's because you're trying it out to see how much higher do I have to go before I see side effects? Or, oh, I hit a dose that's great. It's, you know, the minimum effective dose. I didn't have to go higher. I don't have side effects. So, but we definitely see that THC users, and in most studies that I've read where they do compare CBD and THC, we do see more adverse effects. But I want to point out that they are temporary, they are usually dose dependent, and they can be mitigated by changing the dose, the product, or the timing. Or just discontinuing it. There are some people who can't even handle small doses. The key takeaway here is many participants reported improvement in anxiety and symptoms, particularly with the CBD dominant products. Now, this was an interesting report. So they tracked nearly like 12,000 cannabis sessions. That means that the person used cannabis and documented their experience. What did they take? How did they feel? Were there side effects and so on? And this was through an app called StrainPrint. There were over 3,000 patients that reported a session of cannabis use for depression, 5,000 and change for anxiety, and about 3,700 for stress. And interestingly, 50% reported a reduction in depression, 58% reported reduction in anxiety and stress, so the majority. Women reported larger reductions in anxiety compared to men, which is interesting. And again, this is just all like survey data. The high CBD, low THC users reported that it was best for perceiving, or they perceived lower depression. What's interesting is that this is repeated in other studies or reported in other studies, that high CBD, low THC seemed to work better for depression. And then they reported that a balanced CBD THC, like a 1-to-1 or somewhere in that range, it doesn't have to be a 1-to-1, a 2-to-1, 4-to-1, was best for reducing the perceived symptoms of stress. And then importantly, the use of THC to treat depression may exacerbate depression over time. There's some other studies that show that long-term, now, again, one study showed 27% of people who use THC over time actually said their depression got worse. And it's most likely related to the development of tolerance. When you combine CBD and THC, and this is borne out in the studies looking at a 1-to-1 ratio formulation that's been tested in multiple sclerosis, which in that particular, it's a pharmaceutical compound. It's not available in the United States. It's used in numerous other countries, but it is plant-derived CBD THC in a 1-to-1 ratio. That did not cause tolerance in those patients using it for MS symptoms. And so we know that CBD helps to mitigate some of the tolerance with THC use. So it's important to realize that if you do feel like you're getting a little bit worse with THC, or you're having to escalate your amount that you're using, your brain is telling you, okay, we have some tolerance is okay, but tolerance to the point where you lose the medicinal benefits is not okay. And I encourage people to take some time off or start including some other cannabinoids in there, specifically CBD. Now, this is one of the stronger studies. It was published in July of 2024, and it was an evaluation of a nano-dispersible, you can see in the title, cannabidiol oral solution versus placebo in a mild to moderate anxiety. It was a double-blind randomized clinical trial, so it was 15 weeks, 178 participants, and CBD treatment significantly improved anxiety scores compared to placebo. And that's important because there are a lot of people out there who are still reporting, oh, it's a placebo effect. You know what you're taking, you hope it works, and that influences you. So this is a nice study to show us that that anxiety did resolve or decrease versus the placebo. The participants also reported improvements in symptom severity, depression, sleep, and daily functioning. Now, this too was high dose. This was an isolate, I believe. And remember, with isolates, often isolate means that the CBD is taken away really from all the other compounds in the plant. And remember, the term broad spectrum really talks about it's all the compounds, but very, very low THC, very trace amounts. So in this study, they started at 150 milligrams twice a day. That stops me a little bit because that's a pretty high dose. But again, in a study, you have only so much time, only so much product that costs money, and they usually want to get started. I never start a patient at 150 milligrams twice a day. I like to start low, titrate up, and help a patient acclimate. And also, of course, when you are paying out of pocket, you want to find that lowest dose that gives you the best benefit. There's no reason to go higher dose, because I actually have had parents say, why don't you start at the high dose and back up? And the last thing you want to do is start causing side effects. I always start low and titrate up. And I think that's a good caveat. So they titrated up to 600 milligrams. And as you can see, although there was GI upset and nausea, the side effects were mild. There were no serious adverse events. And in general, what we can say from this is the safety profile is there and the results are there. So overall, this does show that CBD in and of itself can help improve anxiety symptoms. And when you really look at overall, look at all of these symptoms, it's quality of life that these patients have. Day-to-day functioning is really the key, right? Now, what about other cannabinoids? So we have this nice study of CBG from our friend, Dr. Ethan Russo and his team. And this comes from the Washington State University lab. So they surveyed 127 people using CBG dominant cannabis, and the most common conditions for which people stated that they were using CBG was anxiety, chronic pain, depression, and insomnia. Just to make a note, there is some evidence in the scientific literature that CBG can help with anxiety from the test tube and animal studies. And remember, sometimes in the cannabis world, we have access to these compounds really before we know what they can do. But in this survey, these patients reported greater efficacy than their pharmaceuticals, and the percent claiming superiority over the other conventional medications. So 74% of people with chronic pain said CBG worked better than their current other standard of care medicines. 80% said it worked great for depression over their other medicine, and so on. Now, why would it help with sleep? We have no mechanism to understand that CBG is a hypnotic or like a sleep aid, direct sleep aid, but by alleviating anxiety, and also CBG has anti-inflammatory effects. And that's also what we think about CBD is it's not a direct hypnotic, except in very high doses. It can make you tired. But in the lower doses that most people take, it actually could almost be alerting. But when you lay down at night, less anxiety, less pain, less inflammation, which may promote a good night's sleep. In this group, just be aware that about 30% of the patients or the people involved did report using some THC. So it's always hard to tease out what's what. Was it the combination? Because some of these people reported feeling high, having inattention, sleepiness, dry mouth, and increased appetite, all of which are well-known side effects of THC. Now, this next study that Dr. Russo was involved in with the same group, they actually did a double-blind placebo-controlled crossover. So they recruited 34 healthy adults who overall just had kind of, with the testing, they fell kind of in mild anxiety. I think that it's hard to be an adult and not have any anxiety, but this was a group that did not have high levels of anxiety. And they gave them, there was an intervention of 20 milligrams of hemp-derived CBG, or they got placebo. And the researchers evaluated anxiety, stress, mood, memory, and impairment. And they found that CBG significantly reduced anxiety and stress compared to the placebo. Now, it wasn't a major reduction because remember, these weren't highly anxious people to begin with. But interesting, the participants also showed improved verbal memory, and none of them reported feeling impaired or feeling high. I know that the same group and Dr. Justin Sulak are publishing some upcoming research on CBG. And in his study, and he just gave some preliminary information at a conference last year, some people did have munchies. Some people did have feeling a little bit like not having focus, or just some overlap with some THC. And remember that almost all products have a little bit of THC in them, and depending on your sensitivity, you may have a higher likelihood of having just a little bit of that. But in general, we're just not seeing it with CBG. And I've treated many children with CBG, and I have not seen any, and again, full spectrum CBGs with a small amount of THC in there, and I just don't see any evidence of impairment at all. Now, I want to share this patient report. And so this was a 75-year-old woman who came to see me, and she was brought by her adult daughter for anxiety and depression, and she had these symptoms, and they were very significant. She was really struggling. There was a painful family estrangement. I think it was her adult son who stopped talking to her. There was some family blow up, and he hadn't talked to her in a long time. He wasn't open to having a relationship, which devastated her. Poor sleep. She was weeping all the time. She had loss of interest in her activities. She really fell into a deep and anxiety and depression. She does describe having a few panic attacks. She had tried multiple medications and did have Ativan, which she would use for those panic attacks. But she started drinking a lot, and she was using alcohol to sleep at night. And her family just saw her spiraling down and was just really concerned. She was otherwise pretty healthy. She did not care for any of the medications because of the side effects. She felt either too tired or too wired from them. And she said that she didn't feel like herself, although I think that she didn't feel like herself anyway. She was cannabis naive, and she made it clear to me that she really did not want to try THC. And so our initial plan was to start a low dose CBD dominant full spectrum product. And I started her at around 25 milligrams once a day, with instructions to go to twice a day if she tolerated that. And then I gave them a titration schedule to increase in small increments over time, weekly. And I also recommended walking, getting some exercise, getting out into the sun, reducing the alcohol. And of course, I had encouraged her to go to therapy as well to try to talk some of this through. Now, what's interesting is that she didn't really notice any dramatic changes at all, but her family, and her daughter was really good about staying in touch with me. Her family noticed that she had less crying, improved mood, and sorry about that, I duplicated the less crying there, but also she started to sleep a little bit better. And the daughter reported that she was drinking a little bit less, it seemed. And the daughter said she just seemed a little just less down, just her demeanor. And so ongoing adjustments. So as we went through and she saw that CBD did not give her negative side effects, so she didn't have any negative side effects with a very slow titration upward, When I did speak with them, the daughter on their follow-up said that she's still struggling at night. She's falling asleep, but she's not staying asleep. So we decided to add low-dose THC at night for insomnia. Here in California, there is a company that makes these little mints. They're 2.5 milligrams, which I find are a nice way to introduce because they're very small, especially for older people who are cannabis naive. It doesn't look scary. It just looks like a little mint. You can cut them in half to have 1.25 milligrams. And that's where we started. And she started with that 1.25 milligram, and it seemed to help, but she did titrate up to 2.5, and that ended up being her dose. And we did continue CBD during the daytime. So you can see here, after 2 months, she was at 75 milligrams twice a day of CBD, 2.5 milligrams of THC at night. She was sleeping through the night. She had improved mood and functioning. She had stopped regular alcohol use. She actually told me she just enjoys a glass of wine now, every now and then. And she returned back to gardening and walking, social activities. And she was able to successfully discontinue the out-of-van use under the supervision of her psychiatrist. And this is the email that I got from her about a year later when we contacted her for her renewal. She said, "I'm still sad about my son and his wife not talking to us, but it seems better. It seems it's not making me as miserable as it was before, like I'm handling it better." So it gave, when you think about that, and maybe you've heard others talk about this, but when your endocannabinoid system is functioning a little bit better, you do have some buffer, you have some emotional resilience. And that's really one of the most important things to understand about your endocannabinoid system is it gives you that resilience. It helps keep you in balance. But even if you tip out, it's because it's functioning better. You're not starting here and going here. You're actually, may not bounce out of balance so far. I don't know why this works, but it does. I had explained the endocannabinoid system to her, but I think she forgot. I feel like it saved me from going off the deep end. I should have tried this sooner, but I guess I'm old-fashioned and didn't think of marijuana as medicine. And I've had some other older patients or older adults tell me that they feel old-fashioned because everybody's talking about cannabis, but they have these kind of, what they were taught back sometimes in the, 40s, 50s, and 60s, where there was just so much anti-cannabis sentiment, although we still see it today. All right, so let's talk about applying the research in real life. And so CBD is the most studied for anxiety, and it's commonly used during the daytime, but as I've mentioned, some people do report sleep benefits, again, likely due to less anxiety, decreased pain, and inflammation. But be aware it can take time to find the proper dosing. I have had probably hundreds of people who have come into my practice since CBD became available back in, I think it was 2013. We started to see CBD products on the market. Many, many people have come to me and said, "Oh, I tried CBD, it didn't work." And what they're doing is they're buying a gummy or they're buying a tincture or some other product and they're taking it, but they have no idea what they're doing with dosing. Dosing matters. And my analogy to that is if you have a rip-roaring headache and you want to take, let's say, aspirin, you would not crush the aspirin and take a speck of it. Now, I'm not saying that you should use aspirin for headache. The point is that dosing matters, and proper dosing can sometimes be confusing with CBD because there are people who do well at low doses. There are people who do well at medium doses, people who do well at higher doses. There's people who do not like CBD. The product itself, we have to understand. Is it a 1-to-1 ratio? Is it high CBD, low THC? What else is in there? We know now that there's some products where they mix melatonin in. And I even had a patient that came in and said, "I'm so sleepy all day long." And then when I looked at the bottle, it had melatonin, valerian root, and chamomile. I mean, it was something that was not meant for daytime. And so all of that can be very confusing. And those patients that come to me and say CBD doesn't work, the first thing I do is investigate, well, how much did you take? What product was it? Because it may have been that because you didn't know what you were doing, and nobody expects anybody to know what they're doing with this. CBD has such a wide range that until you kind of sort out dosing, you really don't know how you're going to respond. And that's where, why I encourage people to get advice. CBG is emerging evidence for stress and anxiety. Certainly, there are people using it and reporting good benefits. Some people do report better focus, calm, also sleep. And again, why sleep? Because of the less anxiety and less pain, less inflammation. The interesting thing about CBG, and this is based on a number of studies, is that it appears to be maybe slightly more potent than CBD when you compare milligram for milligram. It appears that for CBG, it's a more narrow range of dosing, although I have seen people take up to 100 milligrams. I have not seen 600 milligrams of CBG in a study or in any of my patients or anyone that I've heard about. And remember too, sometimes if you go higher, you can get dose dependent side effects. So again, it's that idea of titrating up. But remember that CBG, sometimes there are people who I even have a patient right now who does well on 2 milligrams. That's all she needs for CBG for her anxiety, and it helps tremendously. And others, like I said, take higher doses. THC is effective at alleviating anxiety for many people. If you look at all of the major surveys that have been done over the past decade or so, looking at why are people seeking cannabis use, anxiety is in the top 3 conditions, the other 2 being insomnia and pain. Cannabis works great for anxiety, insomnia, and pain. And but the idea with THC, of course, is minimum effective dose. It's the dose that gives you the best results without any unwanted side effects. And so for some people, microdosing THC, some others, they take a little bit more. THC has the most narrow window. I would say that in a medical practice, most of my patients are under 20, 25 milligrams of THC per day, but there are outliers, people who have very severe chronic pain, or others that just have tolerance or are not good absorbers or metabolizers. Everybody's a little bit different. And again, dialing in on your dose is key to success. And remember that higher doses may worsen anxiety in some individuals. And it is sometimes, now there's this term greening out, where you can feel really sick from taking THC. But the key with successful medical use is starting low, titrating up. Sometimes in order to know the best dose, it's really important. If you pass up the best dose, that was too much, then you can back down. Very flexible, and that's the beauty of cannabis. And then I just want to share some benefits and risks, and then we'll get into questions. So reduction of unwanted symptoms is, of course, one of the best benefits. Better sleep, better mood. A number of my patients have reported what they call a cascade of benefits. So my anxiety's down, I'm sleeping better, so I started exercising. I stopped turning to food for comfort because I just feel better. And I'll never forget, I had this woman that came in, she was on 7 psychiatric medications. She did not feel good about herself. She had gained a tremendous amount of weight on the antidepressants, which never makes anybody feel good. She didn't feel well. And she felt like the medications weren't helping. I gave her advice. I think we had one follow-up. And then she kind of was lost to follow-up. But then she showed up in my office for a follow-up about at the year mark. And I didn't even recognize her. If I didn't see her name on the chart, I would not have recognized her. She had weaned off all her medications. She had lost 40 pounds and she just felt great. And she told me, fixing this part of her life, her medication part, really, when I think about it, her endocannabinoid system was just not functioning well. And by helping it work better, she found tremendous benefits that cascaded into exercising, eating better interpersonal relationships. She said it enhanced every part of her life. And that's the kind of thing that, as a cannabis doctor, when you're sitting in your office, you realize, why would she pay me to come back? Why is she buying this medicine? And I could see how well she looked. It was, and I kind of joked around with her. I said, last year when you came in, you were like this folded up, wilted flower. And now you're like this, beautiful flower that has bloomed and is just thriving. And so now again, we didn't cure her. She just was able, and this is very important, this last bullet point, cannabis gave her the ability to control and manage her symptoms without the side effects and without kind of just letting her kind of wallow where she was. So, when you have these exchanges with people, these very meaningful results, it's really hard not to shout out to the world, look what this can do for some people, right? So what about the risks? So it's limited with supervision or guidance. I have a paper coming out, hopefully in the next few months. We did a survey here in California of 604 patients who are under medical supervision. And what we're seeing is that very low side effects. Hardly anybody ended up in the emergency room. If you look at the literature looking at emergency room visits for cannabis use, they have absolutely gone out of control. And that is because people don't understand what they're taking or the dosing. And it's just important. I tell everybody, at least check in with somebody one time just to get a sense, get some advice to understand your situation and the risks involved around what is happening with you. Remember too, that all side effects of natural cannabis are reversible as far as we know. And the reason I say natural cannabis is because with the synthetic cannabinoids, we are seeing some irreversible side effects like irreversible refractory depression. There was a case of someone smoking one of these synthetic THC vapes who damaged their vision, which seemed to be irreversible. They couldn't figure out a way to fix that. And again, the risks are very limited by the start low and go slow approach. And then the common side effects I pretty much discussed. But remember, again, they can be mitigated by changing the product, your cannabinoid profile, sometimes the terpene profile, but really by changing the product, dosing, and timing. And then here we go. So tips for success. So start low dose, increase gradually, look for that MED, minimum effective dose. Hang out there. See if over time you start to feel better. This is not a sledgehammer. This is a plant that is going in and trying to balance things. I encourage people to keep a diary of dose, timing, effects, and products. One of the most frustrating times was I was helping an older woman, and she had found a product. It worked great. She called me and said, "What was that product?" And I said, "I don't know. You never told me about a product. Nobody kept track. We had no idea what it was." It was very frustrating. Avoid mixing your cannabis with the alcohol. You may need to adjust the timing if you find that your CBD dose later in the day is keeping you up at night, because some people do have that effect. Then skip that dose, move it earlier in the day. Don't wean other drugs until you feel improved. So we don't want to leave you with a gap where your symptoms have escalated, because that can be very stressful. It's important to have a weaning plan if you're trying to go off medication for anxiety, if you're taking it daily especially. And consider, as I've mentioned a few times now, at least one visit with a knowledgeable practitioner. Sleep matters. Sometimes if we can get you sleeping out of the gate, that will help your anxiety. So of course, poor sleep worsens anxiety. Low dose THC, CBN, which I didn't really talk about. We don't really have studies on CBN, cannabinol for anxiety. And as I've mentioned, CBD, and this should say CBG, may help indirectly. And then two, your lifestyle matters. Exercise, therapy, meditation, being kind to yourself. All of this can help you manage and also help your endocannabinoid system be in balance. There is a very nice article, it's a little bit old now, called The Care and Feeding of Your Endocannabinoid System. And it looks at all the various modalities like exercise, meditation, yoga, osteopathic manipulation, all those kinds of things, and the effect on the endocannabinoid system. All right, I'm going to be able to take questions. Here's our upcoming webinars next month. We're going to talk about minor cannabinoids, so a little more deep dive into CBG, CBN, CBDA, and some others. And then in August, we're going to talk about endocannabinoid dysfunction and its role in fibromyalgia, IBS, and migraines, three conditions that are thought to be have a root cause in endocannabinoid dysfunction. And then please remember, you don't need to do this alone. You can contact us to get more education and personalized cannabinoid guidance. When I say us, I mean all of us here at Realm of Caring, Leaf 411, and Goldstein Wellness. So thank you very much for your time.
Thank you, Bonnie. And I'm so excited for that paper to come out. I'm sure a lot of people are. So keep on staying tuned for everybody who's here. I did see a couple of people join late. So on next Thursday, Realm of Caring, we'll send out the recording through our YouTube, but just check into all of our platforms because we'll have the recording of this webinar available as soon as tomorrow for you guys to check back on. But we did get a couple of good questions for you, Bonnie. So we have a little bit of time, so this is great. But this first one is a good one because if someone seemingly has CHS, so cannabis hyperemesis syndrome, what would you then recommend for depression and anxiety?
And that's a really good question. And of course, it does depend on the situation. But for those who have not heard of CHS, it is an emerging health concern. The first report was in 2004 related to someone who, or to a number of patients that were seen in emergency rooms. What happens basically is that it's usually related to chronic heavy use of THC, although there has been a case described with CBD. But it's mostly, in the cases I've seen, are high doses of THC used over time, very high doses. And nobody really understands why it happens. We used to think that maybe you were hitting remember, THC binds to the cannabinoid receptor like a key in a lock. And we were thinking maybe the cannabinoid receptor was getting revenge, right? It was just not responding well. And what people get is severe nausea. They get sweating. They get these episodes of severe abdominal pain. And what's really interesting is that this condition seems to turn on this thermoregulatory imbalance where you actually seek out bathing in hot water or laying in a hot shower, and because that alleviates some of your symptoms. And if you are a cannabis THC enthusiast, you may think, oh, I'm nauseous, let me take more cannabis, or take more THC. And what ends up happening is you have these cycles, these cyclical episodes of this awfulness. And I will say that the cases that I have only had 2 cases in my practice. We don't often see it in medical use, but someone can have a medical intention and still end up with high tolerance, and they just escalate their THC, or they buy a product that's very potent. But it's very hard to go back to cannabis after you have this reaction. And here and there, I had one patient that after she took off, maybe, I can't remember exactly, but a number of months, she actually said to me she can take a little puff off a vaporizer and it will not bother her, and it helped her anxiety. But any more than that would trigger an episode. And the way she described it to me, you may have heard me say this before, I remember her words very clearly. I'd rather have it in my life in teeny tiny amounts when I need it for my anxiety rather than not have it at all. So she learned to not be such an enthusiast, right? So just not be just reflexive and light up, so to speak. But what I would tell people is broad spectrum CBD, you could try it, but I would say partner with a clinician to understand dosing and to understand your response. Remember too, we have CBG, right? I have not heard anything about CBG causing cannabinoid hyperemesis. Have either of you? No? Yep. So that is something that can give you, and I didn't talk about CBDA because there's very little research, but clinically, anecdotally, people do report that CBDA, which does not act the same way as THC in the brain and the body, it does interact with serotonin and might be an answer. And this is why getting help if you have CHS and you do want to treat anxiety and depression, we do have other cannabinoids that we can try to help you with.
Excellent. And that actually is a good segue to the next question we had because someone asked about CBN. They said it helped them sleep when it's in isolate form, but in full spectrum form, it keeps them awake and mildly intoxicated. So would CBG be a better choice in that regard?
Well, it would be worth a try. So remember, CBN is an oxidative degradation product of THC. So it has very similar targets as THC. And when I say targets, I mean the cannabinoid receptor and some other receptors like the TRP receptors, which are involved in pain and inflammation. CBN, THC is a stronger compound, and it targets more the type 1 cannabinoid receptor compared to CBN, which is about a quarter of the potency. And although it does have some target at the CB1, it's weak there, but it likes the CB2, which is your CB2 receptor is more involved in your immune system, your inflammation. And so by kind of shifting that CBN or not using THC and using CBN, you get kind of a weaker but more anti-inflammatory, if that makes sense. I hope I explained that. But remember too, when you are comparing an isolate versus a full spectrum or even broad spectrum, you are getting compounds in the plant that may be hitting off targets, targets that you don't want to hit. So for instance, in the pharmaceutical world, they may develop a drug and think it hits this target, and then they go and study it and they're like, oh, everybody got X symptom. Well, they find out that not only did that drug target this, but it also unexpectedly hit at what we call an off target. I'm convinced that for some people, because I have seen the full spectrum of response, I have patients, about 5% of people I see we cannot find cannabis that works for them. But narrowing down to a isolate in those particular patients might actually be worthwhile. I've done it in a few patients and have found good results. We're not getting those off targets as much as you would with the full spectrum. I hope that answers the question.
Yes.
I have a lot to say.
Yeah, no, this is great. We have some thank yous. I think if you have time for one more question.
I do. Go ahead.
I think,
Yep.
yeah, I think this is a good last one to end us with. Do you have different approaches for anxiety versus stress? So would you, or how would you approach that?
It's a good question. Yeah, that's a great question. Well, and so to me, anxiety and stress are kind of the same thing. Anxiety is a diagnosis. We don't write stress on a chart, right? Stress disorder. We say anxiety or generalized anxiety disorder is a billable diagnosis. There's social anxiety and so on. So to me, they're kind of the same. When I think about stress, I just think about more day to day. But I think it's the same thing. And what you'll see now, some people say improve mood, in some of the results, I'll say, yes, it helped anxiety. And you would think if you help somebody's anxiety, you might help their mood. But some people have other mood disorders. So we have to remember that, some of this language is a little overlapping, and that's okay. In general, what I would say is that if there is this component that most of us identify as stress or anxiety, most likely we're addressing it the same way with various plant or pharmaceutical medications.
Okay, excellent. Thank you so much. And that rounds up our questions, actually. So thank you for answering those so thoroughly, Bonni. And as I mentioned,
Sure.
this recording will be up on our various channels. So make sure you check in with all of us. There are some good questions about how to get in contact with a clinician. And of course, we have our Leaf 4-in-1 information that I gave there. So you can schedule some time with a consultant, with a nurse, consult with a nurse. And yes, please join us for our next one. And if you have any questions, reach out and make sure you're on all the newsletters and everything. And we will see you in June for the next time. Minors.
Thank you so much.
All right.
Thank you.
Have a good night. Bye-bye.